Good morning. So what you see here is the scapula. Okay, so this is a posterior view of the scapula, and you can see, okay, this is the medial border of the scapula, and this is the lateral border of the scapula, which is hidden deep. Now this is the superior border of the scapula. Alright, so now what I am going to show here is the muscles which are attached to the scapula helps the scapula move. So first of all, let us see the superficial muscles. That is the superficial muscle, the upper fibers of the trapezius, middle fiber of the trapezius, and the lower fiber of the trapezius. So all this together will get inserted into the so this is the spine of the scapula. To the inner aspect of the spine, inner aspect of the acromion process, and also to the inner aspect of the clavicle. So trapezius has an insertion inside the clavicle and acromion and the spine of scapula, while deltoid has an attachment outside the lateral one-third of the clavicle, acromion, and the spine of the scapula. Here you can see the posterior component of the deltoid muscle. Alright. Now latissimus dorsi is called as lateral and dorsal, because you can see, make out that the muscle is lateral and dorsal. This is the latissimus dorsi, lateral. So this is the dorsal aspect, and from the dorsal aspect it goes laterally like this. So it's a small attachment to the apex or the lower angle of the scapula. Now other muscles, if you take out if you reflect the trapezius and the deltoid here and the latissimus also, this is what you see. There is a deeper layer. So in the deeper layer you can see the medial border of the scapula, to which the rhomboidus muscle, that is the muscle shaped like a rhomboid, is attached, which runs from the spine in the center behind and goes all the way to the medial border of the scapula. Similarly, levator scapula arises from the transverse processes of the upper cervical vertebrae and gets inserted to the upper medial border. So that is levator scapulae. Now rest is very simple. So this is the spine. So muscle above the spine is supraspinatus, muscle below the spine is infraspinatus. Now look at the lateral border of the scapula. This border is actually kind of rounded. So anything in medicine, if you call round, we use the term teres. So the muscles, a big and small muscle arising from the lateral border or the teres border or the rounded border will be named after it. So it is called teres major, minor, and teres major. Thank you.